Women's health drugs. The bulk of the teaching about women's health drugs is going to be done in the maternal nursing course. So we're going to do just a very quick overview. Well, when we're talking about women's health drugs, we're talking about estrogens and progesterones usually. Estrogens are the drugs that cause the body changes at puberty, the secondary sex characteristics, and the menstrual cycle. They are often used for contraception, but when that's what they're used for, we give them with progestins. Estrogens can be used for dysmenorrhea and other disorders that are the result of not having enough estrogen produced within the body. It used to be used to prevent osteoporosis. Now, with the research that's coming out, that's becoming more and more controversial, thinking that the adverse effects outweigh the benefit of use for osteoporosis. It should not be used. Estrogen should not be used. They're contraindicated if a woman has abnormal vaginal bleeding and we don't know what it's coming from. We should not be giving estrogens to someone who is pregnant. We should not be giving estrogens to someone who has a thromboembolic disorder. Either they have it now or they've had it in the past. Either one, they should not be using estrogens. And they should not be using estrogens if they have a cancer that is estrogen dependent. Adverse effects. Well, thrombolytic events. This is the most serious adverse effect. People getting blood clots. Hypertension. Then there's a lot of other effects that are similar to the signs and symptoms of pregnancy. Nausea, vomiting, skin changes, the darkening of the face, people becoming sensitive to the sun, breast tenderness, amenorrhea. Progestins are synthetic derivatives of progesterone, and the one in particular that we'll talk very briefly about is medroxyprogesterone, or Provera, or Depo-Provera. Now, these are used as contraception, either alone or together with estrogens. Progesterones can be used to treat amenorrhea, some types of abnormal uterine bleeding, endometriosis, prevention of a potential miscarriage. It's used for some cancers, especially once you're in the palliative phase of treating cancer. And sometimes they can be used to treat premenstrual syndrome. They have adverse effects: liver dysfunction, nausea, vomiting, amenorrhea, breakthrough bleeding, and spotting, edema, weight gain or loss. Contraceptive drugs, well, they're used to prevent pregnancy. They can be given orally, that's the pill. They can be given injectably. Depo-Provera is given as an injection. It can be given transdermally as a patch, or intravaginally through a ring that is placed in the vagina. They may be a combination of estrogen and progesterone, or they just might be progesterone alone. How do these drugs work? They prevent ovulation. They increase the mucus viscosity, make it stickier, which inhibits the sperm motility. And there's some indication that maybe it prevents implantation of a fertilized egg. The risks, well, most of these are due to the estrogen, so this is a repeat of what we said with estrogens. Thromboembolism, hypertension, headaches, depression, nausea, vomiting, increased weight, breast changes. Now, contraceptives interact with a lot of other medications. Okay, this is the list of drugs that decrease the effectiveness of the oral contraceptive. So if you give these drugs along with oral contraceptives, don't count on the oral contraceptives working. The couple have to use some other backup method while both of these drugs are being used. And this list here are ones that are affected by oral contraceptives. It's the other way around. If a person is taking these drugs and then they start taking oral contraceptives, these particular drugs might not work so well. The anticonvulsants may not work as well. The hypoglycemic drugs might not work so well. So all of these drugs here. Alright, very briefly, osteoporosis. It's low bone mass. If we have a low bone mass, we have an increased risk for fractures. And quite often, in older women, osteoporosis and fractures can lead to death. It is a disease that is primarily seen in older women, women who are postmenopausal. And one of the first line of treatment for this is calcium supplements and vitamin D, because vitamin D helps with the absorption of calcium. These ideally should be given or give it through dietary forms before menopause. Young adults, that's when bone mass is being built. There are other drugs that can be given postmenopausally, or as the disease seems to be coming, or as the woman's natural estrogens are decreasing. The biphosphonates, we have Fosamax and Beniva, Actonel. We have selective estrogen receptor modifiers, and we have hormones. Some of the drugs inhibit bone reabsorption, so they inhibit the breakdown of the bone. Some of them stimulate bone formation. Some of these drugs can be used to prevent osteoporosis, and some of them are used to treat them. The adverse effects depend on the drug. Now, for most of the drugs, especially the hormones, smoking is a big no-no, because smoking is going to increase the woman's risk for having some kind of blood clotting problem, thromboembolus. If a person is pregnant, they should not be using these drugs. So you're going to review the systems, all the body systems for contraindications when using these drugs. The biphosphonates, a person has to be able to stand or sit for 30 minutes after taking it. Estrogens and progesterones. People need to know how to take them and what to do if a dose is missed. If they're being used for contraception, quite often being late in taking the pill, not even totally missing it, but being late might be enough to result in pregnancy if she has sex. We need to talk to these women about sun protection, because they will have skin darkening from sun exposure, and they may be more prone to sunburn. These women need to report weight gain. They need to have annual exams, follow-up exams. They need to have annual pap smears and breast exams. Whether these drugs are associated with cancer or not is still unknown. We have studies that say they do and studies that say they don't. And with all drugs, we're monitoring for therapeutic responses and adverse effects.